Hi there. Welcome to Anonymity 1D. My name is Matt. I am a diabetes educator and also have type 1.
My name is Alex. My son Miguel has type 1.
In this video, we go over how to manage ketones when blood sugars are normal or even low. Please remember that this is for informational purposes only and is not meant to replace your doctor or care team. Thank you. Hi Alex. Hi Miguel. Nice to see you both again. Today we will go over what to do if Miguel has ketones with normal blood sugars. Managing that is a little tricky.
Sounds good. I didn't know you could get ketones with normal blood sugars. When does that happen?
Alex, do you remember we talked about when we get ketones? Ketones are formed when we break down fat, our backup energy source. Let's take the example of what happens if you have a stomach bug. With a stomach bug, just like with any other illness, the body needs more energy to fight the infection. We may also have symptoms like nausea, vomiting, diarrhea, and decreased appetite. This leads to not eating enough carbs and not absorbing all the carbs that you are eating. This combination of increased energy needs and decreased carb intake leads to our body using the backup energy source, which is fat, and forming ketones in the process.
That makes sense. So, should I check Miguel for ketones every time he has a stomach bug?
That's right. If Miguel has nausea, vomiting, stomach pain, fever, or any illness, regardless of his blood sugar, you should check him for ketones. If you recall, ketones can be checked in the blood using a blood ketone meter or in the urine using ketone strips. Both have their pros and cons, but the main thing is to remember to check for ketones and have one of these options always available.
How do I get rid of the ketones in this situation?
The pillars of sick day management are similar to when you're treating ketones with high blood sugars. Two of these pillars pertain to intervention, namely insulin and fluids. The other two pertain to monitoring, mainly checking sugars and ketones. We just went over when to check for ketones and how.
How often do I need to check Miguel for ketones? Is it similar to sick day management with high sugars?
That's right. You check blood ketones every 2 to 3 hours and urine ketones every time he uses the bathroom.
Last class, you mentioned that insulin stops new ketones from forming, and that is how we turn things around. Is that what we do here too?
Correct. Never stop insulin, even if Miguel's sugars are normal or low. That is how his body will stop new ketones from forming.
How do I do that without making his blood sugars go too low?
We do a couple of things differently with his insulin to avoid low sugars. First, you can decrease his insulin doses, both the basal and the bolus. How much you cut back depends on the ketone level. Remember, ketones indicate insulin resistance, so the higher the ketone level, the more insulin resistant he is, and the less you need to cut back on his dose. If he does not have any ketones, then you can decrease his basal by 20% and give him just half his bolus. For blood ketones of 0.6 to 0.9 or urine ketones that are trace or small, you can decrease his basal by 15% and give him his full bolus dose or a little less, but you do not need to cut by half. If blood ketones are 1 to 1.5 or urine ketones are small to moderate, you don't need to cut back on any of his doses. For blood ketones of 1.5 or higher or urine ketones of moderate or more, apart from giving him full doses, you also need to give him 5% of his total daily dose for the ketones. He should still get insulin for carbs so that the carbs can actually get into the cells, and the cycle of starvation ketones is stopped. But you can dose him after he eats to make sure that he keeps it down and is not vomiting.
So Dad gives me insulin after I eat, and not before?
That's right, Miguel. It might be safer to dose after you eat, so that he can be sure that you actually finish what you eat and are not going to vomit.
How often can I give Miguel insulin?
You can give him insulin every 2 to 3 hours, and sync it to when you check him for ketones, so you can add extra for ketones if you need to.
Is cutting back the insulin dose the only way to prevent low sugars?
No, there are other things that we do too. Let's go back to the pillars of sick day management. We talked about ketones and insulin. Another way you can keep Miguel's sugars up are with fluids. If Miguel's blood sugars are below 200 mg per deciliter or 11 millimol per liter, you should give him fluids with carbs like sports drinks with carbs or oral rehydration solution.
Got it. Is the amount the same as with sick day management with high sugars?
Yes. He should get half to 1 ounce every 15 minutes or 4 to 6 milliliters per kilo per hour. Small sips are better than drinking a lot at one time. Apart from carb-containing fluids, also try to give him something more substantial like bread, applesauce, rice or lentil broth, rice porridge or crackers, especially if he has small to moderate ketones or more. These will help break the starvation ketone cycle and also sustain him longer than the fluids.
Can I use Miguel's CGM to monitor his sugars?
Yes, you can. Keep an eye on his sugars every 2 to 3 hours, either with a glucometer or through his CGM.
All of this is to make sure his sugars are not too low, is that correct? So, what blood sugar range do I maintain him at?
The goal is to keep Miguel's blood sugar above 90 milligrams per deciliter, which is 5 millimol per liter. If you need to give insulin for ketones, it would be better to have his blood sugar around 150 or higher. If his sugars are above 200, then you switch to carb-free fluids and follow the sick day protocol for high sugars.
What if his sugars drop to below 90? What do I do then?
This brings in the fifth pillar of sick day management with normal sugars. This is unique to this protocol, and that is glucagon. We usually think about glucagon as an emergency medication that we use when sugars are too low and Miguel is not responsive. It has a role here too. Let's look closer. If Miguel's blood sugar is very low and he is unconscious, then glucagon is used. Glucagon is like a key which releases stored glucose from the liver to raise his blood sugar quickly. There is a technique where you can give really small doses of the injectable glucagon to release a little stored glucose and bring the blood sugar up. For this, we use insulin syringes and not the syringe that glucagon comes with. This is, of course, not possible with nasal glucagon and possible with only some formulations of injectable glucagon. We will look at what Miguel was prescribed to see how much deeper we need to discuss this. Let's recap how we manage sick days with normal or low blood sugars. We check blood sugars every 2 to 3 hours with either a CGM or glucometer. Try to keep it above 90 mg per deciliter or 5 millimol per liter. Aim for 150 or higher if you need to give insulin for ketones. With ketones, you check blood ketones every 2 to 3 hours and urine ketones every time he uses the bathroom. For fluids, you should give him carb-containing fluids like sports drinks with carbs and oral rehydration solution. The recommendation is half to 1 ounce every 15 minutes or 4 to 6 milliliters per kilo per hour. Try to give him more substantial carbs too, like bread and applesauce, and dose him with insulin for that to prevent starvation ketones. If you are not able to keep his blood sugars above 90, and you have the correct formulation of glucagon, then you can give mini doses of glucagon to bring his blood sugar up. Regarding insulin, you can dose him after he eats to make sure he does not vomit. If he does not have ketones, you can cut back his usual basal and bolus doses by 15 to 20%. For moderate ketones, you give him full doses, and for large ketones, he may need extra 5% of his total daily dose for the ketones. If he keeps vomiting, can't keep fluids down, looks tired, or you can't maintain his sugar above 90, call us immediately. He may need to go to the hospital.
I can see how this is different compared to managing ketones with high sugars. I will have to compare both side by side, but it is more familiar now.
Perfect. Let's look at what kind of glucagon Miguel was prescribed and double-check his doses. Then we're done.
We hope this gave you a better understanding of sick day management with normal or low blood sugars.
Please remember that this is for informational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.